So one of the other things a lot of people ask is regarding health and sports facility, because Coventry is a fairly younger city compared to many others. So could you tell us what kind of things are happening in Coventry under Labour administration regarding sports and health?
I think one of the things that our administration done over the last few years is to bring public health and sport together. And I think sport and the availability of sport provision is absolutely key to public health. Now we start very much at basics in our parks, where we've marked up in respect to running markers in a number of our parks and green spaces, and we've seen people using the parks during the pandemic, and it's been a real godsend for many people, and it certainly helped in respect to people's mental health, and it's been part and parcel of the wellbeing agenda. At the same time, what we've had to do is to effectively ensure that we replaced some of our much loved facilities, but were clearly tired facilities. That meant that places like Livingston Road and the Coventry Baths have been replaced over a period of time. What we have done is build a new facility at the 87 Centre. We've got a magnificent 50-metre pool at the Alan Higgs Centre. That for many people, they've not really enjoyed that use, but it will come into its own as we move out of the pandemic. And we've kept our promises as well in respect to some of the sports which effectively have not been able to be accommodated at the Wave. In particular, the bowls facility at Graveston Road in Camden. That was a promise that we made, and what we want to do is to encourage all sports. I think that when we became European City of Sport in 2019, it was for a very good reason, because we got a good story to tell. It is not just about elite sport. Elite sport's exceptionally important. We've got the Wasps, we've got Coventry City Football Club now in the Championship, and we've got Coventry Rugby Club in their Championship as well. And of course we've got the Coventry Blaze. But all of this is professional. That's a top linked sport. But what we need to do is to ensure that we offer facilities so that people are in a position in which they can actually participate. It's about participation. It's about getting that participatory number in sports up, and it doesn't matter what you do, it is exceptionally important, whether it's lighter exercise or heavier exercise. It all adds to well-being and a feeling of physical well-being, and that's related to mental well-being. So public health is something that I believe covers all ages, and that is why public health and sport stand alone. Other authorities don't do that. Other authorities put public health in conjunction with adult social care. I don't think that's right. I think public health covers every age group, right from inoculations as youngsters, and we know that there are a lot of youngsters in schools, in particular around year 6, because that's when youngsters move to secondary schools. We know that the number in Coventry as elsewhere who are obese is totally unacceptable, and we've got to work on that. That is a major public health agenda, and it's part of the rationale why public health is with sport and public health is not attached to either children's services or adult social services. Public health is a whole life service.
Thank you, sir, very much.